and just give people a few more minutes or a little bit longer to tune in. Again, this is a live webcast, so just wait a couple more seconds and we'll get started. All right, so my name is Grace Emily Stark. I am the editor of Natural Womanhood. Thank you all for tuning in today to listen to our live webcast with Dr. Marguerite Duane on choosing a FAM. I'm here, like I said, with Dr. Marguerite Duane. She is the co-founder and executive director of FACS, which is an acronym that stands for the Fertility Awareness Collaborative to Teach the Science. Is that correct, Dr. Duane? Did I get that right?
Fertility Appreciation Collaborative.
Fertility Appreciation, that's right. Okay, sorry about that. And that makes a lot more sense than what I said. So thanks for being here with us today. Dr. Duane has agreed to do this live webcast with us here at Natural Womanhood on choosing a FAM. We realize that choosing a fertility awareness method or a method of natural family planning can be a really big step for women, for couples, especially if you have previously been on some form of pharmaceutical contraceptive drugs or devices. It can be a really big step. And as we talked about in our previous topic of the month on getting off the pill for good, there's a lot of different reasons why people are on the pill to begin with, or other contraceptives, and a lot of reasons why they are now considering in bigger and bigger numbers getting off the pill. So what are you left with, right? FAMs are a great option, and if you've never learned about FAMs before, if they're only vaguely familiar to you, this webcast is for you to learn a bit more about the background of fertility awareness methods, how to pick the one that's right for you. And there's going to be a little bit of something for everybody here today. Even if you are familiar with fertility awareness, I think you're going to learn some things today about maybe why you'd want to switch a method, or the history of these methods that you might not know. So there's a little bit of something for everybody on our webcast today with choosing a FAM. And again, I want to thank Dr. Marguerite Duane for being here with us today. Dr. Duane, if you'd like to just introduce yourself a little bit more for our viewers, and then we'll get started with the interview and answering some of these great questions we have for you today.
Sure. Well, yes, great. And thank you so much for inviting me to share today about how to choose a fertility awareness-based method. And I think the first thing to highlight is that the wonderful thing is we do have lots of choices. As you said, I am co-founder and executive director of FACS, which is an organization actually dedicated to educating medical professionals and students, the next generation of healthcare professionals, about the science underlying natural or fertility awareness-based methods. And I may occasionally use the acronym FABM. It really is equivalent to FAM and natural family planning. So I may use those interchangeably. And for many listeners, they may wonder why they've not been offered any fertility awareness-based method from their medical professional. And the reality is so few physicians, nurse practitioners, midwives know about modern FABMs and the many different options that really are effective and have broad applications and are widely appealing to women. So in addition to my role at FACS, I am actually a practicing family physician as well with my own direct primary care practice. So I actively use these methods day to day in my work, whether it's helping my adolescents who are just getting their period know when to get their, when their period might be coming, or young couples in their 20s who are trying to prevent pregnancy for a time, or even women in their 30s and couples who are trying to get pregnant. And of course, I have perimenopausal patients who are trying to navigate that transition. And the beautiful thing is with fertility awareness-based methods, there are so many different options. So regardless of how old you are, where you are in life, what reproductive stage you're at, whether adolescence or postpartum or perimenopause, the best thing is there's a variety of options that are available. So I'm excited to share about that with all of you today. Thanks again for having me, Grace.
Well, thanks for being here, Dr. Duane. So right off the bat, I think let's just define some terms. Let's just assume we have some people listening today who will be listening to this webcast in the future once it's living on YouTube, What is fertility awareness? What's an FABM, a fertility awareness based method, a fertility awareness method, an FAM, oftentimes referred to as a FAM? What's natural family planning? Can you define those terms for us and maybe give us a little bit of an idea why there even are separate terms, how they're interrelated? Just define some terms for us, please.
Yeah, and I think that's always a great place to start. In fact, FACS offers webinar presentations, and in each of the webinars, we begin with let's define the terms. So the term natural family planning may actually be more familiar, especially to an older audience, because this term was actually coined in the early 1970s by the National Institutes of Health. And with natural family planning, um, and the term, it is important to note, the term natural family planning and fertility awareness-based methods can be used interchangeably. They both essentially mean women learn to observe natural signs of their cycle to identify when they may be fertile and when they're not fertile. That is, when they're not capable of becoming pregnant. And then couples can use this information when they're able to identify that potential window of fertility to modify their behavior depending on their family planning or their healthcare goals. So again, the term natural family planning really highlights that these are natural methods. They actually do not require women to take any drugs or use a device that will disrupt the normal functioning of their reproductive system. Whereas the term fertility awareness really highlights it's based on an awareness of your body and of your cycle to identify when you are fertile and when you are not. And with fertility awareness based methods, women and couples then base their choices of their sexual activity depending on their family planning goals. So again, the term natural family planning and fertility awareness based methods and fertility awareness methods can really all be used interchangeably. I will say in the medical literature, the term FABM is the more widely used term. The term FAM, or fertility awareness method, was initially coined, to my knowledge, by Toni Weschler in her book, Taking Charge of Your Fertility. And a lot of people hear the word FAM or think of the word FAM and equate it to the symptothermal method because that's the method she taught about in her book. But it's important to note that the symptothermal method is only one of many different fertility awareness-based methods. So I like to point that out and make that distinguishing point. And we actually highlighted this in a recent blog post on our factsaboutfertility.org website about the importance of terms. At Facts, we do tend to use the term fertility awareness-based methods more commonly because natural family planning really highlights the family planning aspects of these methods, and they are true family planning methods, right? Couples can use them if they're trying to prevent or postpone or avoid a pregnancy, or they can use them if they're trying to achieve pregnancy, depending on their family planning goals. But with fertility awareness-based methods, they are so much more. Young women can use these methods to simply observe and track their cycle to better monitor their health. And the female cycle and the female cycle chart can serve as a fifth vital sign and highlight potential abnormalities that may indicate underlying conditions or issues that may need to be addressed. Ideally, by working with a physician or other medical professional who's trained in fertility awareness-based methods and or restorative reproductive medical approaches. So really important to understand those differences. One other thing that I want to point out, and there's some confusion, like does the term FABM or FAM automatically mean using your observations of your fertility in combination with a barrier method, so to speak? So if I know when I'm fertile and I'm going to choose to use a condom because we want to have sex but we don't want to get pregnant, that's actually more accurately referred to as a fertility awareness combined method. Because at that point, if you recognize you're fertile, right, and you choose to use a condom, you are in effect choosing a different method. So
Yes.
you have to be careful not to combine them all into two. And so, again, Facts just recently published a paper in a peer-reviewed medical journal, Frontiers in Family Medicine, that is an overview on fertility awareness-based methods and their different applications for women's health and family planning. And we do make this distinction that when you combine your knowledge of your fertile window with another method, whether it's a condom or withdrawal or some other method of with the morning after pill, you're actually, it's better to refer to this as fertility awareness combined approach. So um, I know a lot of your listeners are probably very well versed in fertility awareness based methods, but it is really important to make sure that we get language that is accurate so people are all on the same page. So
Yeah, that was a really thorough definition. Thank you so much. That did not disappoint. Um, and I wonder if after I ask you your next question, if you could maybe just lean in a little bit closer to your microphone. I'm getting a little feedback that it's a little quiet, but thank you
sure.
for that, for all those definitions, for explaining the nuances between the various names and hammering home for people that, when we're talking about fertility awareness methods, we're talking about using the signs and symptoms of, a woman's natural fertility, and that you're making decisions based upon that. And that in a true fertility awareness method, you would then choose to abstain during the fertile period,
Mhm.
um, if you're trying to avoid pregnancy, that is, and not rely on a condom, because at that point, your family planning method is actually a condom.
Right.
So
And
I think that's a really important point to make, and thank you
yeah.
for raising that.
And well,
I want to go back to what you said, about how in 1970, the NIH defined the term natural family planning, because I think for a lot of people who are just now, diving into this world of fertility awareness, um, they think that it's this brand new thing, and it's really not, right? So I wonder if you could delve into the history of these methods for us a little bit more. Where did it start? And let's tackle the issue head on, while we're doing this, talking about the history of where the rhythm method fits into all of this and how it
yeah.
differs from what we're talking about, which is modern methods of fertility awareness, natural family planning.
Sure, absolutely. I'm happy to address those. And I should say, I think it was 1974 or 1976 that the NIH coined the term, and then the World Health Organization did it a couple of years later. And it's funny to hear you say that, a lot of people may not have realized these methods have been around as long as they have.
Yeah.
But if you ask people in the medical community, the only natural methods they know of are is the rhythm method, right? And there is a
Hmm.
lot of misinformation and misperception and misunderstanding of the methods and of the
Absolutely.
history. And I think it is important to note that the rhythm method itself was first developed in the early 1930s. In fact, in 1932, it was introduced in a book that was written by an obstetrician gynecologist, Dr. Leo Latz, and it was specifically called The Rhythm of Female Fertility and Sterility. And it was actually based on the latest research at the time from the 1920s. There were two independent researchers, one from Japan and one from Austria, that discovered ovulation occurs pretty consistently about 14 days before the next menses, with a range of about 12 to 16 days. That discovery was critical. And based on that information, Dr. Leo Latz, working with patients, developed formulas for women to be able to calculate that potential window of fertility. In order to determine their potential window of fertility, women would need to track the length of their 6 previous cycles, and then using the data from that, specifically the length of their longest cycle and the length of their shortest cycle, they would use a formula to, to calculate their potential window of fertility for the next cycle. Most people don't even realize that that's what the rhythm method is. And when I ask people, say like, oh yeah, that's the rhythm method, right? I ask them, well, can you define what the rhythm method is? They don't understand that it actually is based on data from the previous cycle lengths that is used to calculate. A lot of people think the rhythm method is, well, I ovulate on day 14, so I don't have sex between day, 10 and 18. Well, that's not always the case. In fact, only about 15 to 20% of ovulations in healthy ovulating women occur on cycle day 14. So the myth of ovulation occurring on day 14 is that it's a myth. It does happen, but it's actually a minority of the time. So the rhythm method, when it was introduced, again, it was based on the best science at the time, and it was introduced 30 years before the first birth control pill was introduced. So it really was the only option for women. Now, the
Hmm.
rhythm method has never been well studied in clinical trials to demonstrate whether or not it is effective or not. But if women and couples use it according to the formula, it is likely that it would still be relatively effective. The key difference, though, between the rhythm method And modern methods, and this is really important, is that the rhythm method uses retrospective data or historical data. What was the length of my 6 previous cycles to try to predict what's going to be my fertile window today? It's like, it's June. I'm planning a camping trip with my girls this weekend. Let me look at what was the weather like the second week of June last year and the year before, and base my choices of our clothing and our tents and our equipment based on previous data. No, it's actually better for me to go out and check the temperature right now. Look at the report right now to see what is it in real time. With modern fertility awareness-based methods, rather than simply using historical data to try to predict future fertility, women can use data in real time, observations that they make. And these are observations of the 3 key signs that indicate when they are fertile and when they are not. The first sign is their cervical mucus or cervical fluid secretions, which is produced under the influence of the female hormones estradiol and progesterone. And a woman's cervical fluid secretions will change throughout her cycle under the influence of the different hormones. The next sign that women can learn to observe is her basal body temperature. This is the temperature that's taken at the beginning of the morning, first thing when she first wakes up, and she tracks it every day. Ideally, she's taking it at about the same time every day. During the second half of the cycle, after ovulation occurs, a woman's temperature, basal body temperature, will naturally rise by about a half a degree. So that's a pretty clear observation and confirmation for her that ovulation has occurred. And again, it's data in real time. The third sign that women can learn to observe are her urinary hormone levels. Now, the most well-studied urinary hormone measurements from a natural family planning perspective are the estradiol metabolites and LH hormone that is detected using the Clear Blue Fertility Monitor, which is the monitor used in the Marquette method, the most widely used urinary hormone-based method. With this, women have the monitor and test strips, and each morning they dip the test strip in their urine and put it in the monitor, and the monitor will tell you if you have a low reading, meaning there's no signs of fertility, your hormone levels are low, a high reading, which indicates your estrogen levels are beginning to rise, as they do preceding ovulation, so you're entering into that fertile window, and your peak reading. And that's when the monitor will detect LH hormone or luteinizing hormone, which is what triggers ovulation to occur. So all of the modern methods, whether it's the Billings ovulation method, the symptothermal method, the Marquette model, all use different signs of fertility, either cervical mucus alone or cervical fluid secretions plus temperature and or plus urinary hormones, for women to learn to be able to identify that potential period of fertility. So again, together with her partner, they can, make an informed choice about their family planning goals at that moment.
Right. And the idea of tracking your cervical mucus is not anything all that revolutionary or new.
Yeah.
Like you mentioned, the science of all of this goes pretty far back. When was Dr. Odeblad looking at cervical mucus and the
Yeah.
patterns of cervical mucus? Was
So
that
let me talk about the history. So we talked about the rhythm method. The Billings ovulation method is actually the first modern method that was developed, and it was actually developed in the early 1960s by Doctors John and Evelyn Billings. And they worked extensively with Dr. Eric Odeblad, who was a physician and a scientist, and he actually spent 50 plus years studying cervical mucus and cervical fluid secretion. And much of what we know about the cervix and cervical fluid secretions is based on the work of Dr. Eric Odeblad that began in the early to mid 1960s. So the Billings ovulation method was the first modern method to really be developed and take off. Soon after, the basal body temperature only method was introduced, and this was using basal body temperature alone, again, so couples could confirm ovulation. It would help them identify the end of the fertile window, but it didn't really give them great information about when that fertile window would start. So it left couples with less usable days if they were trying to prevent pregnancy. In the late 1960s, early 1970s, the syntothermal method really began to take shape and to take off. With the syntothermal method, women observed cervical fluid secretions plus basal body temperature. In the United States, this method was widely taught through the Couple-to-Couple League, which was founded in 1972, I believe, and became one of the most widely used natural methods in the United States. In the late 1970s and early 1980s, working off of the work of the Billings, Dr. Thomas Hilgers developed the Creighton model, which again is a cervical mucus or cervical fluid secretions only method. Dr. Hilgers, as an OBGYN, really wanted to try to standardize the observations and the collection of data and really use this information to help inform the diagnosis and management of a wide range of women's health issues. And so in addition to developing the Creighton model that women can learn to track their cycle, he also developed natural procreative technology, which is a system of medical applications and surgical applications to use the cycle chart data to better address women's health issues. In the 1990s, that's when Dr. Richard Faring from Marguerite University developed the Marguerite method. Again, that uses both cervical fluid secretions plus urinary hormone measurements. Some women may choose just to observe urinary hormone measurements, and Marguerite has different protocols depending on what you want to observe. Around that time as well, in the late 1990s and early 2000s, here at Georgetown University, where I am an adjunct associate professor, at the Institute of Reproductive Health, they developed the standard days method and the 2-day method. Now, I should say I actually did not work for the IRH, but I very much appreciate the work that they have done. And their work is primarily focused on making these methods more widely available overseas to populations of women that might not have access to any forms of family planning. So their goal was to develop methods that were well-researched, but simple to learn and use. So with the standard days method, it is unique in that it's the only method that actually does not require observing any of the signs of fertility. Rather, for women that have very regular cycles between 26 to 32 days, they identify a fixed window of fertility from day 8 to 19 when they may be fertile. When they studied this method in thousands of patients, they found it could be very effective, and so the World Health Organization classifies it as a modern method because it does have strong scientific support to great speeds. They also developed the 2-day method, which is a very simple cervical mucus method, which can be used for family planning, but since it does not help women identify whether or not they ovulate, it may not be as broadly applicable. Also in the United States, where women tend to just experience significant more cervical fluid discharge that may not be related to fertility, it can be more difficult to use that method, but it has been widely used, again, globally. And then the other method that the Institute for Reproductive Health really refined is the lactational amenorrhea method. And I like to tell people that's actually probably was one of my favorite methods to use because it doesn't require anything other than nursing your baby. So women who have recently given birth within 6 months, who are nursing exclusively and who have not had a return of menses, can rely on the lactational amenorrhea method to effectively prevent pregnancy. As soon as the baby's nursing drops off or she gets her period, then she can no longer use that method. But it is a very viable option for a lot of women. And I know I said it was my favorite method to use. I should state, in part because of the work that I do and because of who I am, I have actually used almost all of these methods and can speak to this because personally there are different times in a person's life when one method may be better than another method. But I hope that historical overview helps people to understand how these methods have evolved and how they continue to be refined and studied to ensure we're offering the best evidence-based options for women and couples to choose.
Thank you for that. And I think that was such a great, thorough overview of all of the main, most popular methods today. The only one that I didn't hear you mention was FEM. And maybe in this answering this next question, you can define that one a little bit more for us, because obviously we know with all of these different methods to choose from, some people can feel really overwhelmed and not really know which one is right for me. Do I want to go with a mucus only method like Billings or Creighton? Do I want to go with the monitor like Marquette? Do I want to add in the thermometer and the basal body reading with my cervical mucus measurement observations, like with
Mhm.
the symptothermal method. So, what questions should a woman or couple be asking themselves when they're looking at just the lay of the land when it
Yeah,
comes to fertility awareness, all the options available, and which one might be right for them? What are some helpful questions people can ask themselves to help determine?
great question. And before I answer it, I will touch on FEM and neofertility. Um, FEM stands for Fertility Education and Medical Management, and that was actually developed really within the last 10 years. And FEM was developed not so much as a family planning method, but more so from a health monitoring and management method. I discussed how Creighton developed NAPRO technology, which includes medical applications to address a wide range of women's health issues. FEM has done something very, very similar. Through FACS, we offer an elective to medical and nursing and other health professional students, not only across the country but across the world. And it is open um, for students to register. But we often get students asking us, well, which, if I want to go more and get additional training, do I do FEM? Do I do Creighton? Do I do neofertility? Um, FEM really focuses on the underlying endocrinology of the methods and addressing the hormonal aspects, whereas in Creighton, there's a little bit more emphasis on the surgical approaches and techniques for addressing women's health. So they
Mm,
both have a lot to offer. But FEM, again, was developed in the last 10 years. It's primarily a cervical mucus only method, but they do have some protocols where they will teach women to test urinary hormones as well. Neofertility, which I mentioned, and I'm not sure how familiar you are with this method, Grace. This is also
a
a
little bit, yeah.
very new method, really within the last few years. It was developed by Dr. Phil Boyle, who is a family physician in Ireland.
Hmm.
And again, the approach is much more using it from a women's health and medical applications perspective, and especially in addressing infertility. And so Creighton, FEM, and neofertility offer opportunities for medical professionals to get trained to go above and beyond just teaching women about how to chart their cycle, but how to use the data from the cycle chart to better address women's health issues. Now, all that being said, which method should a woman chart with? And you talked about like, oh, there's Marquette and symptothermal, and do I look at mucus? Do I look at temperature? Before you get to any of those questions, the first question I encourage my patients to consider is, what is your primary reason for learning a fertility awareness-based method? Because
Yeah.
that's going to tremendously influence which method you should use. Are you choosing a method like, my 15-year-old patient this week because she just wants to monitor her health and know when her period's going to come so she's not caught off guard by that? Um,
Hmm.
are you dealing with some health issues, maybe more emotional or hormonal symptoms that you're not sure what's happening? You're noticing some abnormal spotting and discharge, and you really want to try to get at the root of that. So is your focus primarily, I want to use this to address underlying health concerns? Are you using the method because you want to prevent pregnancy? Most of the methods that I mentioned all have solid scientific studies demonstrating their effectiveness for preventing pregnancy, with the exception of femininity or fertility, because they're primarily from a medical applications perspective. That being said, they can be used from a family planning perspective as well. Um, or is your goal to achieve pregnancy? So again, there's lots of different methods to choose from, but the first thing you need to consider is, why do I want to use a method? Once you've determined that, then the next question I ask yourself is, what are your cycles like? Right? Your really regular cycles between 26 and 32 days. At that point, pretty much any method is open and available to you, except for the lactational amenorrhea method. But you can use standard days or Billings or symptothermal. What if you have irregular cycles? It's interesting because medical students and other health professionals are taught, well, women with irregular cycles are a contraindication or a disadvantage of using fertility awareness-based methods.
Yeah.
When in fact, I would say the opposite is true. If you have irregular cycles, you should be using a method so you can get at,
Absolutely.
why are you having those irregular
Yep.
cycles? What is the underlying cause? Are you having really painful periods? Again, these symptoms suggest there's probably underlying health issues related, and so you might want to choose a method that is associated with medical applications and medical protocols. So those are the first two questions that I strongly encourage women to ask themselves. After that, then we get into the conversation of, well, what signs do you want to monitor? Again,
Mm-hmm.
cervical fluid secretions or cervical mucus really forms the basis for most of the modern methods
Mm-hmm.
and really can provide, I think, the broadest amount of information because they will change depending on the hormone. So, under the influence of estradiol or estrogen, as it's commonly referred to, cervical mucus tends to be more clear, stretchy, watery, or lubricative. Under the influence of progesterone after ovulation has occurred, cervical fluid secretions will change significantly, and secretions may dry up completely, or women may notice really thick or sticky type mucus. So that's the first question. And are you comfortable doing that? I did a well child check earlier for a 14-year-old, and I was talking about cervical fluid secretion, just giving me a look like, I don't know about that. But I also talk about how this isn't really hard to learn how to do. Like using a fertility awareness-based method, it's not rocket science. Like if you
No.
can remember to wipe when you go to the bathroom, just wipe before you go to the bathroom and pay attention. How does that toilet tissue feel when it runs across your perineum,
Yeah.
that area of skin between the vaginal opening and the rectum? You know, if you can do that, you can learn to observe your cervical fluid secretions, right?
Yeah.
Some of the methods, like the Billings ovulation method, even though it's a mucus-only method, they actually do not require you to touch your cervical fluid. They really focus on sensation as the key parameter.
Yes.
Creighton does encourage you to finger test it, but again, it depends on your comfort level. So cervical fluid secretions, is that a sign you want to monitor? Basal body temperature. When I first started using a natural method when I was getting married, I wanted a double check. I liked the idea of like checking my mucus and checking my temperature so I knew. But then
Yeah.
I realized I was terrible at taking my temperature at the same time every morning. I'm not a morning person. I'd roll out of bed and be in the shower like, oh, I totally forgot to take my temperature again. But for some women who are like have a really regular sleep schedule and they keep their thermometer there on their bedside, it's
Mm-hmm.
really easy for them to check their basal body temperature in the morning. I do want to use this opportunity just to mention there are now devices like Ava bracelets and other devices that women can use that monitor their temperature throughout the day and give them an
Yeah.
average reading. I do want to emphasize that we don't have studies yet looking at those methods specifically, and we don't know if your average daily temperature, how that correlates to the basal body temperature.
Yeah.
So just a word of caution for your user, like, well, I can't take my temperature every morning, but I'll just let my bracelet, tell me what it is.
Yeah.
So it can be effective potentially, but we just don't have the science to show that yet. But if you can
Yeah.
remember taking your temperature every morning, that can work really well. And then do you want to check your urinary hormone measurements? Again, there's a little bit more cost involved. In addition
Mm-hmm.
to the Clear Blue fertility monitor that checks estradiol and LH, there are other test strips now, like True test strips that can measure progesterone, um, and others that are being developed to track multiple different hormone measurements. So that's the next question you really want to answer. Like, what signs? And do you want to monitor more than one? Um, After that, then it's what is most important to you? What factors? Is it how easy the method is to use? Is it how affordable it is? Is it how effective it is? Is it can I learn from an in-person instructor or can I learn online?
Yeah.
So they have apps that are affiliated with it. And I just want to use this as an opportunity. I know a lot of women are discovering fertility awareness methods through apps, right? And there's a big
Mm-hmm.
push to learn from an app. And I tell women, you are smart. You are smarter than your smartphone. So don't let the app tell you when you're fertile. Learn
Yes.
to track those signs. And the other
Yes.
thing I'd like to point out is the effectiveness of these methods for almost all of them have been done when women learn from trained instructors. So don't
Yes.
relegate that role to a device. Learn from a trained instructor. Using an app to help facilitate tracking, that's great.
Yeah.
And so that may be an important consideration. But again, if you're uncertain, your signs are a little confusing, don't necessarily rely on the app to tell you what to do, but go back to that trained instructor.
Yeah.
So
Right.
hopefully that helps outline like the key questions and starts to give women and couples an idea of like factors to consider.
Yeah.
And then finally, they just need to think about their own situation. Like, do they have limited time and resources? Do they have irregular cycles or irregular sleep schedules? Are they breastfeeding? Do they have medical needs? Lots of different things for them to consider. But Facts offers a webinar that we originally developed with Natural Womanhood on the science of the female cycle
Hmm.
using method where we specifically go through this in detail. And we encourage listeners who want to go in more depth on the science of the female cycle, the different methods there that are available, the applications, both from a family planning and health perspective, as well as how to choose a method and why it's a healthier option than what commonly offered. And we encourage them to visit our factsaboutfertility.org website under webinars. I think we offer that again next in July.
Great. Thank you for that great explainer. I think the next thing I want to discuss with you is, we know a lot of people are hesitant to jump into FAMs and that sort of thing because there's this misconception of them being less effective than, the modern pharmaceutical methods, the
Mm-hmm.
drugs, the pills, the IUDs, devices. Um, and we know that's not the case.
Mm-hmm.
Uh, but can you speak to the effectiveness of these methods? And when I'm talking about effectiveness, I mean in, postponing pregnancy. If you're using this as a family planning method, a lot of couples want to know, does it work? Can we trust it to plan our families the way that we want to? So there's been, a lot of controversy over the years in how they've measured the effectiveness of these methods, especially in terms of what the CDC will tell you about method effectiveness rates. And they even treat fertility awareness methods a little bit differently in clinical studies. They'll throw out cycles where there was no intercourse
Yeah.
to be had in them, which they don't do when they're studying contraceptive devices or pills. So can you speak a little bit more to the effectiveness of these methods, how the effectiveness is measured? Each method kind of does their own studies and that sort of thing, and what can we trust in terms of the effectiveness of these methods and how they've been studied?
Sure. No, that's a great question, and I'm happy to answer it, especially since through Facts we did the first large review of effectiveness
Right.
studies of fertility awareness-based methods. It was with our lead author, Dr. Mike Manhart, who's on our advisory council. Um, and we looked at all of the studies of fertility awareness-based methods from a pregnancy prevention standpoint. I should say a couple years after doing that review, I actually did a review of effectiveness studies of birth control pills, which was interesting because there were actually fewer high-quality studies of the birth control pill effectiveness than there were even of natural fertility awareness-based methods. But when it comes to effectiveness of natural methods or fertility awareness-based methods, there's three things that I think it's important for people to understand to use a method effectively. One is learning from a trained instructor because these are behavioral methods. You need to learn to make observations in real time and then make your choices based on that information.
Right.
Two, have a partner that's supportive. I mean, these methods, again, it's noted as a disadvantage that these methods require partner support, but these are a shared responsibility, right? You need to have a partner that is willing to work with you during your window of fertility. Ironically enough, women are only fertile for a very short time period in the cycle, like anywhere from 3 to 6 up to 7 days per cycle. Whereas men are fertile pretty much all the time. And so you need the men to be supportive um, and acknowledge and work with you when you identify that fertile window. So learning from a trained instructor, partner support, and then motivation. Because natural methods do not do anything to disrupt or interfere or disable the normally functioning reproductive system, if you're fertile, you are potentially able to conceive because you haven't done anything to shut down your body. There's no time needed to wash out the hormones that you've been dealing with, right?
Right.
So motivation is important. And when we look at the effectiveness studies, it's important to look at when did they ask couples what their family planning goals were. I mean, if I ask you today, you want to have a baby in the next year? Your answer might be, no, I'm good. If I ask you in 3 months, you might be like, yeah, I think I do maybe want to have a baby, right?
Yep.
The other thing is the decision to have a baby or to try to get pregnant or not, it's not a black and white for most
No.
people. It's not a, yes, I absolutely want to get pregnant. No, I definitely don't want to get pregnant. It's really more of a scale of like 1 to 10 with like, yes, I want to do everything in my power to get pregnant. One, I absolutely don't want to get pregnant. And I
Right.
think most people live in that mushy middle of like 4 to 7, like, yeah, it'd be nice to get pregnant. Like, we're really not trying, but it wouldn't be the worst thing in the world.
Yeah.
If your motivation isn't really strong and you don't have a serious reason to avoid, and your libido is the highest when you're the most fertile, you might be having that conversation. Do we really need to wait? And so women and
Right.
couples can change their minds. When it comes to the effectiveness studies, I want to point this out. Fertility awareness-based methods have effectiveness rates that are comparable, if not better, than other behavioral methods of family planning, like birth control pills and condoms. Those methods both require women or couples to do something on a regular basis,
Right.
or at the time, to try to prevent pregnancy. With effectiveness, you can look at two things. You can look at correct use, which is if the method's been used perfectly, exactly as it's designed, versus typical, like I didn't remember to take my temperature this morning, or I forgot to make a couple cervical mucus observations. I think the typical use effectiveness rates are really the more accurate of the two to discuss. With
Hmm.
correct use, modern fertility awareness-based methods all have correct use rates, at least with the Billings, symptom hormonal creatine methods, all have correct use effectiveness rates of greater than 99%. With typical use, it can range. It can range anywhere from 86 to 98%. And again, it is important to look at when did they check effectiveness in the study. For example, the highest quality Billings ovulation method study showed a typical use effectiveness rate of 90%. And this was in a rural, poor, low literacy population in India, where
Right.
they asked the women at the beginning of the study, at the beginning of the year, whether or not they wanted to get pregnant. If they didn't want to get pregnant at that time, they were put in the avoid. Well, if they changed their mind 6 months later, they were never withdrawn from the study. Yet they got pregnant, that would have been misclassified as an unintended pregnancy, which may not have actually been the couple's intentions.
Right.
Um, Whereas the highest quality symptothermal study that was done by Dr. Frank Herman and colleagues in Germany shows a typical use effectiveness rate, that is, people forgetting to take their temperature here and again and whatnot, a typical use effectiveness rate of 98%.
Hmm.
Now, with this study, they asked couples at the beginning of each cycle, what is your pregnancy intention? And at the beginning, if they said they were trying to avoid, they were kept in the study. But if at any point they said, well, no, we're not trying to avoid anymore, they were withdrawn from the study. So I remind people, you really can't compare the effectiveness rates of the different methods apples to apples, because the studies were done differently and they were done in different populations. To your point, um, there was another review that was published a few years after ours by Arudia and colleagues, and they did exactly that. Like they pulled out cycles where there was no documented intercourse. Well,
Right.
abstinence is a part of using a natural method. And
Right.
for a variety of reasons, couples may choose to abstain for the full time. You know, maybe they have a
Hmm.
serious reason, maybe somebody was traveling, but that does, I think, deceptively lower the effectiveness rates. Because to your point,
Okay.
when we look at birth control studies, we don't track whether or not couples are having sex. So it's very
Right.
possible they're just as effective because they're also not engaging in sexual relations. So we really do need better research, more consistent research, in terms of the methodologies and whatnot. But I can say with certainty that modern fertility awareness based methods can be extremely effective, and they can work for couples from all walks of life, and they can work for couples who have a variety of reasons for preventing pregnancy. Now, if a couple has an extremely serious reason for preventing pregnancy, and I had a patient come to me once because her doctor insisted she absolutely had to have an IUD because if she got pregnant, she could die. You didn't appreciate the scare tactics, nor did she, because even though the IUD has very high effectiveness rates, it is not 100%, right?
No.
And this woman had been using a natural method and felt very comfortable using a natural method and wanted to continue, but her doctor simply didn't have information to give her. What I advised her is if you can confirm ovulation has occurred in that cycle, then you can safely use the remainder of that cycle. Now, that meant that that couple had fewer usable days because they avoided sex from the beginning of her period until she could confirm ovulation, but they were willing to make that sacrifice for her health. And
Right.
I had that conversation with her 5 years ago, and to my knowledge, she has still not gotten pregnant again, still happily married. So these methods can be used effectively, but it depends on your motivation.
Right.
There's another billing study that was not actually cited in our review or even the Arudia review, because it was not available in the English language, but it was the only study that actually was a comparison of a natural method and a conventional method. And this study looked at the Billings ovulation method versus IUDs. And it was interesting because what they found is that the Billings method actually had comparable effectiveness rates to the IUD.
I
Now,
believe
it's
it.
important to note that this study was done in China more than a decade or two ago. China has very, very restrictive child um, policies, right? So
Yes.
women may not have only been internally motivated, they may have had a lot of external motivation to use the method effectively.
Yeah.
What it showed is that these methods can be used effectively. Again, it depends on your willingness to learn from a trained instructor, to be motivated to chart your signs, and the support of your partner to be able to communicate on a regular basis, like, what are our goals? Do we want to try to avoid? Do we want to try to achieve? Or are we just, and on Facebook, on social media, I see like the 2TA trying to avoid and the 2TC trying to conceive. And a few years ago, I discovered the 2TW, which is trying to whatever. Like, we're not trying to prevent, we're not trying to achieve, we're just doing whatever. And,
We're seeing how
for
it
some
goes. Yeah.
people, for some people that means they'll get pregnant right away. For some people, they won't. So,
Yeah.
but yes, these methods can be used very effectively. And again, I would refer patients to the newest paper that Facts just published, and I'm happy to share that so you can put it in the resource notes, that is fertility awareness-based methods for women's health and family planning, where we go through the effectiveness rates based on the two reviews, both for preventing pregnancy as well as looking at all the studies of the methods and their effectiveness for helping couples achieve pregnancy.
Thank you for all of that. You keep harping on, and rightly so, how a teacher is really, really critical in the method that you've chosen to have that support via an instructor. And how do couples go about finding instructors these days? It's a lot easier than it was before, but still for somebody who's brand new, how do they find a teacher? How important is it, to choose a particular teacher in a certain method?
Yeah.
Let's just talk about that piece a little bit more, because that is very unique to fertility awareness. You don't need somebody to teach you how to take the birth control pill, right?
No.
But you do need someone to guide you through learning a fertility awareness method. You don't need them to hold your hand forever, but at
Right.
the beginning, there is that learning curve, and it's really critical to be learning it from a trained instructor. So let's talk about that a little bit more now.
Right. And when I'm talking with my patients about the importance of using a teacher, I'll often use the analogy of when women are learning to breastfeed, right? People think, well, I'm just charting my cycle. It's natural. It should be easy. Why do I need to work with someone to tell me how to identify my fertility signs? And again, it's similar to when women are breastfeeding. Like, breastfeeding is natural. And for some women, it can be very easy. But you don't wait to learn how to breastfeed when the baby is born, right? We encourage women, you know, learn about breastfeeding beforehand and then work with a lactation consultant to help, especially for women that may struggle. Fertility awareness educators serve a very similar role. I'm a big believer that we should be teaching our young girls how to chart their cycle at
Me
a
too.
very early age, right? I mean, in fact,
Yes.
facts just, although our focus is primarily the medical professional community, we've got
Hmm.
our webinar, The Facts About Fertility for a general audience, and we have our webinar, Know Your Body, for an adolescent audience. And we're offering that as a webinar actually next Tuesday. But I believe if
Great.
you can learn how to chart your cycle early, before you need to know it from a family planning perspective, it will
Yep.
be much easier. So how do you find a teacher? The great news is there are more and more and more teachers out there, but it is still really hard to find. Up until very recently, the only way you could find a teacher was by going to individual method websites because there wasn't a uniform database. I know Gerard from Natural Womanhood and I have discussed this. We're both working on building databases of teachers and educators. So I know Natural Womanhood has one on their website. Facts is building one on our website as well, so that women can try to find teachers in the various methods. On our Facts website as well, under our About Fertility tab, we have information about each of the about each of the methods. We've got patient education handouts that physicians can print out or that women or couples can access to learn more about each of the methods before they jump into a method website. And in our directory, we do link to the different individual teaching organizations. So if you can't find a teacher in our directory in your area, you can link to the teaching organization of the method of your choice to try to find a teacher there. Um, Different methods also have like tools. So like FEM, I know through their website you can access teachers. Home Mission, which is not a part of Marquette specifically, it is a network of Marquette teachers that women can visit their website to find teachers in the Marquette method. What's encouraging to see is there are more and more instructors now that are being trained to teach multiple methods, which can be really, really helpful for you to be able to work with someone, and then if the method you first learned from them isn't ideal, changing to a different method and potentially working with that same instructor just to learn a different method. So I definitely would refer people to the Natural Womanhood website and our factsaboutfertility.org website to access the databases. And if we don't have them readily available, again, we link to the individual method websites to be able to find one once you've decided which method will work best for you.
So the next thing I want to discuss is, if you've gone through the trouble of learning a method, you've developed a relationship with a particular instructor, when would it make sense for you to maybe consider changing that method? Maybe it's not working out. Maybe you're in a different season of your fertility. Can you
Mm-hmm.
talk about how it's okay to change your method and why a woman might want to change her method? Why couples might consider changing their method?
Yeah, yeah, and it is important. It is okay to change your method if the method isn't working for you at that time. I mean, as I said earlier, I mean, I've used all of the different methods, and in part it's because at different phases of my life, different methods work better. Oftentimes, when women are first starting, especially if they're not sexually active and they want to try and keep it really simple, I do encourage them to start with fillings because it is a very simple, very straightforward method, and it gives you really good information about what's happening with your cycle, how to identify your peak day, which can then help you anticipate when your period is, right? And for a lot of women, that works really well. I had just give me some patient stories. I had a patient that was using it, used it very effectively, wanted to get pregnant, used the method to get pregnant, and it worked really well. After the baby, she couldn't thrive, but then she started having mucus back and forth, and she was a little concerned, like, I can't tell, I'm not sure, I don't feel really confident in that. The methods that have the best research and protocols for use in the postpartum period is really the Marquette method. It's probably done the most research. And a lot of women like that because if they had a baby recently, maybe they're not sleeping as regularly, and so it's harder to use a symptothermal method. And whereas with the urinary hormone checks, that is still easy to use because you don't have to check it at the exact same time every morning. So, a lot of women do find in the postpartum period Marquette to be an ideal method. Women that have health issues often will find that using the Creighton model or FEM can be very helpful because you can work with doctors that are trained to interpret those charts. Now, I should say, and I probably should have said this right from the very beginning, I myself am trained in multiple methods. I'm trained as a Creighton medical consultant, a FEM medical consultant, and NAPRA medical consultant, and as a Teen Star educator, which incorporates the billing population method. So I'm trained in all of these methods. Um, there are times when I have patients that come to me for infertility and they're using symptothermal, and I'm getting enough data from that, and that's fine. I don't need to ask them to switch to a different method. If you change jobs, maybe using symptothermal, and you really have liked it because you're one of those people you just want to cross your T's and dot your I's, but now your schedule's a little bit more erratic and symptothermal may not be work as well for you, then you may want to switch at that point. So really it comes down to, is the method still working for you to achieve your goals for using a method at this time? And that's the other thing. Like maybe you started using a method because you wanted to monitor your health, but now you want to use a method to avoid pregnancy, and you may not feel as confident in this method of your choice initially, and you may want to switch to another method. Or maybe you want to use the method again to try and get at some underlying root causes of medical issues. And the method that you're using, maybe you're using standard days and you're like, I just need more information. Like standard
Yeah.
days is great. I'm having really regular cycles and it's worked really well. But now I'm spotting and I just can't really tell when I'm spotting. So maybe it would be worth using a method that allows you to track cervical fluid secretion. So I'd encourage you to go back to those original questions, starting with what is your purpose for using a method? at this time? Has that changed from when you started using the method that you're using? And does the method that you're using currently help you still to achieve your current goals? If not, what are the other options? And like I said at the beginning, the best part is women have lots of options.
Yep.
And as a physician trained in these methods, I strongly believe it's our responsibility and our duty to really give women the full range of choices when it comes to their family planning options and truly give them an informed choice when it comes to fertility awareness-based methods. For that reason, we're trying to educate more doctors so that they can be supportive of women and help guide them in choosing a method. And I should say on that note, Fax is coming out with a study soon on a shared decision-making tool that we developed that is really designed for medical professionals to use with patients to help guide them in that decision-making process of
Great.
what method should I use. So we're putting the final touches on the tool itself. We've gotten lots of feedback and made modifications after our research, and we hope to make that available on the factsaboutfertility.org website soon.
That's wonderful. Wow, that is going to be such a helpful resource for women and their doctors. I'm really happy to hear that you guys have been working on that. I can't wait to see what it looks like. Um, I think you did a good job of touching on how, with the different seasons of fertility, there are different methods that might fit better with certain seasons. We've talked about how some women in the postpartum period feel a little bit more comfortable with the objectivity of Marquette and the urine hormone analysis with the monitor. We've talked about how if you're having certain issues with your cycle, that maybe you want to go with a method that has a little bit more the medical side, the medical protocols attached to it, so you can diagnose some things, or if you're working through infertility. Um, and you did a great job of talking about which of those methods kind of fit under those bills. One thing that we haven't really talked about yet, and we've actually had a listener question about, and we do get a lot of questions about, is the perimenopause time, as a very important season of fertility that can throw a lot of women for a loop, especially if they are tracking their cycles. So, what is there a particular method that you found? I'm curious in your work with your patients that seems to fit better with that season, that perimenopause season.
Yeah, that's a great question. Oftentimes in perimenopause, women's cycles are more irregular, they're more anovulatory, meaning they're not ovulating, and so it can get really frustrating using Marquette, for example, because maybe it detects estradiol, but you don't ovulate, so you never get that peak, right? So I actually don't recommend Marquette in the perimenopausal period, or even symptothermal, because again, you're looking for that rise in basal body temperature, and if you're not ovulating, you're not getting that. So typically in the perimenopausal period, I will recommend women use a mucus only method, either Billings or Creighton. I have one patient now, a 49-year-old, she's actually a religious sister, who's been charting with Creighton for over a year, and it's been
Oh, wow.
incredibly helpful as we've been able to support her hormonally by providing bioidentical estradiol and progesterone support to help her escape what she described as her hormonal nightmare. And so it's been really, really, really effective. So yeah,
Great.
the perimenopausal period time is a really tough period. Fax is actually doing a virtual conference this summer, and we're doing 4 half-day sessions. And our next one is actually on Saturday, June 25th. And at each conference, we have a topic on reproductive transitions. And the one on June 25th is specifically going to address the transition in perimenopause because it is a very common time when a lot of women are struggling. A lot of women are done building their families. They're very concerned. They don't want an unintended pregnancy. They do remind women, the likelihood of natural conception after the age of 45, even with, women who are still cycling, is so low,
Yeah.
despite what, we might think because of all these older women that are having pregnancies in their mid to late 40s. I don't think most of those are being naturally conceived. So, but still, women want confidence in a method. And so
Yeah.
some women may want to still do that double check. Some may just use the proved test strips occasionally to see, am I getting that progesterone, spike so I can feel confident. But typically, I will almost always recommend a method that uses cervical fluid observation. So it may be a Billings or Creighton only, or a symptothermal, especially for women who are like, yeah, I just want to be able to confirm ovulation with that temperature rise. So that's typically what I recommend.
Great. Thank you for that. I wanted to kind of finish up by talking about the different Femtech and apps and that sort of thing. I think we've kind of briefly touched on those earlier a little bit, but I think it would be helpful just to reiterate what kind of the line is on all of these new technologies. Can we trust them? What role can an app really play? And because there are some that seem to be fairly effective, but what are kind of the rules of thumb when it comes to approaching a femtech device or an app that's purporting to be, natural family planning?
Yeah, great question. And the femtech industry is $1 billion industry. There are a lot of apps, over
Yeah.
500, I think, at last count, is what we had cited in our paper. And about 5 years ago, Facts had actually done a research study where we were looking at apps that were being marketed to women for the purposes of avoiding pregnancy. At that time, um, again, this is about 5 years ago, there were nearly 100 apps on the market. We ended up excluding over half of them because they were actually not even based on any of the modern evidence-based methods. Like they were still using some sort of a calendar calculation type approach to help women
Hmm.
to determine a woman's fertility window. In the end, there were about 10 apps that we recommended. And that study and that summary sheet can be found on our factsaboutfertility.org website if you search apps, and you can see the ones that we recommend. Now, that being said, the study was done a few years ago, and there have been more apps since then, and some apps have modified their algorithms. Um, to date, there have only been two apps that have specifically tested their app from a pregnancy prevention standpoint, and that is the Natural Cycles app, which has received FDA approval, as well as DOT, Dynamic Optimal Timing app, which has now been integrated into the Clue app. So you can't Google DOT and find the DOT app. It is now a part of the Clue app. When women ask what app they should use, and I get that question all the time, again, it goes back to why are you using the app? If they're using it from a health perspective, unfortunately, even though Creighton is the most has been around the longest and has the most data in terms of medical applications, they don't have a specific app. They've got like a web platform that's available to their users. But both FEM and Neo-Fertility have great apps that I think are really helpful because it not only allows you to track your fertility signs, but symptoms when they occur in your cycle, which for me as a physician is incredibly helpful to see where you're experiencing these symptoms relative to where you are in your cycle. So for a health monitoring perspective, I really like the FEM app and the Neo Fertility app. For teens, there is a new app, and I'm blanking on the name. I think it might be something like Know Your Body or something
Hmm.
that's specifically geared for a younger population.
Hmm.
When it comes to other apps, if you're using the symptothermal method and you've learned through couple to couple leak, then I recommend you use the app that they have developed to use in conjunction, which is the Cycle Pro Go app. Billings
Yeah.
Ovulation Method also has their own app. I think it's NFP charting online. So I tell women if you're going to use an app, ideally find out if you've learned your method from a trained instructor, what app they recommend or is affiliated with the
Yeah.
method that they're teaching. If you're
Yeah.
not learning from a trained instructor, again, encourage you to do. If you really don't, again, Natural Cycles has been approved as a DOT, which is now part of Flu. And if you're using it from health monitoring, FEM, and Fertility, I think they're both great. But again, I would encourage people to check out our app summary sheet. There were some other apps that were on there that I don't think I mentioned, like Sympto.org and Sympto Pro. I will say we divided it up into those that predict the fertile window and those that don't predict the fertile window.
Yeah.
And I just want to point out that just because an app does not predict the fertile window does not mean it's not a good app. In fact, I think it's actually almost a better app
I
because
agree.
it's really encouraging you to know your body.
Yeah.
Don't rely on the app to tell you when you are fertile
Yeah.
and when you are not. And there's apps like Kindara. It will predict the fertile window for you if you're saying you're using the method to achieve pregnancy. But if you indicate you're using it to avoid pregnancy, it won't predict the fertile window
Yeah.
for you. So again, I caution women. I always say buyer beware when it comes to apps because the other thing is you don't necessarily know what they're doing with all of your data, and the
Right.
data that you're entering is very private, very personal data. So I encourage women to exercise caution
Yeah.
when choosing to use an app. And again, to remember you are smart, you are smarter than your smartphone. So rely on learning the method and making those observations and interpreting it for yourself rather
Yeah.
than the app telling you what to do.
Yeah.
One other note, we talked about apps. There's more and more devices now being developed, monitors, right? We talked about the Clearblue fertility monitor. We've talked about Prove test strips, Pre-Mom test strips. There's now monitors like the Mira monitor and the Anito monitor. I, as a researcher, physician, educator in the field, it's hard for me to even keep up with all of the latest.
Yeah.
And so, as part of our Facts Virtual Conference series, we also have a track on Femtech. Last month, we had Dr. Thomas Bouchard, who's done a lot of research in this area, present looking at different apps. He's going to do another presentation where we're going to get into more detail about some of these newer monitors and how they can be used from a family planning and medical applications perspective.
Yeah, there's a device I think that purports to actually detect your own cervical mucus for you now and
Yes.
give you some information on it. We've heard a little bit about that.
Yeah, I think that's
And I
the kind
do,
of advice. But
yeah,
yeah,
I encourage people to check in with facts on that presentation because that'll probably be very interesting. And yeah, there's probably a lot of things in there that I haven't heard about that you haven't heard about.
yep,
It's just it's exploding this
right.
area, and there's a lot of good about that. But there's also,
Caution.
yeah, caution, take things with a grain of salt. And I just think I love that you keep reminding women how smart they are, that they can learn this stuff, that they can know their bodies. It's not rocket science. The Billings method has been taught to women of low or no literacy across
Yes.
almost every culture
Every
in the
continent.
world. I think they've even taught it successfully to blind women.
Yes.
This is not something you need a degree. And I really
Right.
bristle at any of you know, the recommendations against fertility awareness that come from this very, frankly,
Patriarchy.
misogynistic place of,
Yeah.
oh, women can't figure this out. It's too complicated. Women don't want to learn this. It's just safer just to give them an IUD or a pill. And I just really bristle at that. I
And I
find
will
that
say the
very
exact
offensive.
opposite is true. Women want to know and they get angry. I mean, that's the
Yes.
response I often experience when I tell women about these methods. They're angry. They're like, why has my doctor never told me this? Why have I not learned about this before? I
Right.
mean, I didn't share this, but I did not learn about these methods until I was a first year family medicine resident. I had graduated from medical school and
Yep.
I've been cycling myself for years, and I thought to myself, how is it I'm passionate about women's health? I'm doing full spectrum family medicine. Why did I not learn about this when I was in
Yep.
college? And the only option that was offered for my medical condition was birth control pills. Like there's so much more out there for women, and women deserve this information. And
Yep.
again, they deserve doctors that know this. So well, our conference, I do want to say, like, they're geared more towards the medical professional community. Anybody is welcome to register to attend. So even if you're
Hmm.
not a medical professional, if you're interested and you want to learn more, you're certainly welcome. Because the more we can educate, then you can go back and take this information to your medical professionals and encourage them to learn more so they can support more women to be empowered in caring for their health.
Yeah. And the last thing I want to mention is just, we've talked a lot about the health benefits and how empowering fertility awareness can be, what women can learn about their bodies when you're choosing, a FAM that works for you. Um, One thing we haven't even touched on, and we could do an entire different webcast on, is
I'm happy to
just,
come back anytime,
yeah,
Grace.
we'll have you. The relationship benefits, the intimacy, the communication that grows between a couple
Absolutely.
who's using a fertility awareness method. When you're taking a pill, that's on you as a woman, right? Your husband's not at all involved in any of that. He might not even know when your prescription is out and when you're refilling it. But with a fertility awareness method, there's so much more communication, there's so much more intimacy. You're talking about things that you otherwise wouldn't really have a lot of occasion to talk about, right? And I think it would be
And I think
helpful to
this is,
hear from a medical provider if you've
yeah.
seen, just couples growing in intimacy and love and communication over the course of learning a method.
Yes, yeah. I mean, I joke. I mean, when you can talk with your spouse about your cervical mucus, there's really no topic that's off the table. I mean, talking about your finances doesn't seem nearly as complicated when
No.
you're talking about cervical fluid, right? So it does make it easier in some ways. And the thing is it because women experience their fertile window on a cyclical basis, on a monthly basis, it does require the conversation on a regular basis. So it does foster, facilitate, encourage regular conversation and communication. For some couples, it might be like, I'm still not into it this month. Like, I'm not ready for another one. Okay, great. Well, we're going to press pause for a week. okay, great. But for others, it might be like, we said we were gonna wait for another year until we finish school, but I don't know. I'm just really feeling like now might be the time given what's happening, and so it does facilitate healthier, more in-depth conversation. That being said, I also don't want to gloss over that these methods are easy. They can be challenging,
Yeah.
especially when couples are not on the same page. And
Yes.
the reality is, and for those of you that are married, you can appreciate this, you're almost never exactly on the same page with your spouse, whether it comes to
Hmm.
your family planning choices or what you're going to have for dinner that night, right? You have differing opinions. And so it does require, good communication skills and developing those communication skills. But over time, and the research bears this out, the couples that use fertility awareness-based methods or natural family planning methods specifically have been shown to have higher levels of satisfaction, not only general satisfaction, but sexual satisfaction, because it is more of a give and take versus it's all on you and I get you when I want and I don't have to participate in playing a role in the family planning conversation. So, women feel more respected, they feel more
Yeah.
engaged, and overall it is healthier both emotionally and certainly physically because you didn't state this, but it should be stated. Natural or fertility awareness-based methods are the only form of family planning with no medical side effects. And
Yep.
that's critical. And that's the number one reason why women stop using birth control methods is
Yep.
because of the side effects. So they should be offered a method that is safe and effective and has a variety of options for them to choose from depending on where they are in their life.
Yep. That's a great place to end there, and it's just so important that we at Natural Womanhood continue to get the word out about these methods. It's so important that you guys at FACS continue to educate physicians, because a lot of times, like you mentioned yourself, you go through medical school not hearing about any of this, and you're
Mm-hmm.
blindsided on the back end of it, right? But you guys are working so hard
We
to
are.
rectify that, to not only get electives into medical schools, but to provide this continuing education for doctors who are, already minted MDs who want to go back and learn more about these things. And I really encourage anybody listening to visit factsaboutfertility.org. That's the FACS website, and especially if you're a provider, to learn about how using fertility awareness in your practice can, benefit your patients. Um, I want to briefly plug too that, all of the work that we do at Natural Womanhood as a nonprofit organization, including this webinar, all the webcasts we put out, all the articles we put out, it is all donor funded. We cannot do this work without you. We need your help. We have a $40,000 matching challenge right now. It got extended till June 15th. Please go to naturalwomanhood.org and click the donate button and figure out how and if you are able to donate to help us continue putting out information like this so that more women and couples get this information into their hands. Um, we really thank you all for tuning in today. Thank you, Dr. Marguerite Duane from FACS, for being with us here today for this really informative, I think very engaging webcast for our audience. And yeah, we just want everybody to know about this. We want everyone to have this information. We think it pays dividends for women and couples.
Thank you so much. I was really delighted to join you all.
Thanks.